Hi there, I'm Claire.
And I'm Ben.
And we're your dental besties.
A podcast all things dental.
Or not. Mostly not.
Today might be a little bit. Actually, no, not. We're going to go with not.
We're not. I like the ones that aren't.
I'm going to go straight in with a question that I have for you, actually.
Okay.
And you are an author in this field.
Oh, am I?
You are. Yeah. Facial aesthetics.
Oh, I am indeed.
Oh, just that small novel I wrote all about
funny story about that. I basically how that came about is, remember COVID lockdown? Yeah. We weren't working and I needed to.
Well, I was.
Were you working?
I was working.
Oh, because the university. Oh, see, I was at home not working.
Okay, enjoying life.
That doesn't sit well with me. Well, it doesn't. Do you know what? In hindsight, I would take it a lot more. Like I would rest a lot more. But at the time when we didn't really sort of know what was going on, and wages wise, obviously being self-employed, you're not getting paid. So. Although I think there was a little bit of help there, I decided I was going to use my time wisely and I wrote a course and a book.
Okay. Well done you. So you were working.
Yeah. And in that time probably made more than being a hygienist. So that's just me. That's how I roll. But yes, so I wrote a book about complications and it turns out in aesthetics, everyone's worried about complications, so it went down well. The problem with books is that you have to keep marketing them once you've written it. Yeah. So, and I don't actually do aesthetics anymore. Well, very much anymore. I don't advertise for it anymore, so it's not something that I generally think about or.
Did you do a lot of it before?
I did, yeah. I was going to leave dentistry and go into aesthetics.
Really?
That was the plan. Yeah, that was the plan. And I worked at a clinic over kind of like East Riding of Yorkshire way, and it was a lovely clinic and absolutely loved working with the people there. Started getting more and more into teaching, and in my sights I was going to have like this academy, and and I did enjoy aesthetics at the time, but post-COVID, dental got very busy, and then as time went on, I sort of got a little bit disheartened with the whole aesthetics field. And
what particularly did you get disheartened with?
I tell you, so when I first qualified in aesthetics, I thought I could do anything, not do anything to anyone, but like I could handle any situation, and filler was the answer, Botox was the answer. And although you can make some fantastic changes to people's like life as well and face, I got to a point where I found myself saying no a lot more often than I was saying yes to treatments. It wasn't always worth the headache. So obviously you learn as time goes on, and then, you hone your skills and you realize there are limitations to some of the treatments. And I found myself thinking, okay, if I can't, and everyone should do this anyway, but if I can't absolutely guarantee you the result, then I'm just not even going to attempt it, because it's not worth it. It's not worth it.
It's quite tricky, isn't it?
It is, and I think a lot of people out there, for me, it was more the fact that the people I was dealing with, you've got to think the type of people that are going in, a lot of them, like Botox, for example, a lot of them just want to have that youthful appearance. But what I found with fillers is people thought fillers could do a lot. So like 1 mil, which is what they would probably be prepared to pay, because my prices were on the higher side. And I did that on purpose, because I was like, this is taking a lot of a lot of skill, a lot of training, a lot of money to train in it as well. And I would only use the best products, like expensive products. And so you have to, obviously, it's a bit of a premium to be able to offer that. And so my prices weren't low, but people would be like, well, can I have 1 mil? And they'd expect
a face full of filler. And
I got myself to the point where I'd be saying to patients, do you know what, save your money. You probably need to go down the surgical route, because non-surgical isn't the answer to everyone's problems. And there's a certain point where people come to you, and at that point, filler's not going to really get you where you want to be. And so they'll have this idea in their head what they want, and unless I can give that to them, which is wasn't always the case.
Unachievable kind of results.
The expectations were so high, and you just know the type of patients as well when they would come in and you'd be like, you're going to be a headache and it's not worth the money, so I'm not even going to attempt it. And I just found myself saying no a lot, because with experience I could tell who was going to give me a lot of, because with aesthetics there's a lot of anxiety. because a lot of things can go wrong, and you're dealing with someone's like external
your anxiety.
Yeah. So a lot of things can go wrong, especially with fillers. So you've got like vascular occlusions and things like that. And although you're trained to deal with them, and I purposefully put myself into positions where I was like, right, I want to be really hands-on with the materials that are going to help in those circumstances, so that it's not like, if that circumstance happened, it's not the first time I've ever like touched hyaluronidase. Do you know, like I want to be able to like have used it, you know, reconstituted it, drew it up, you know, so that if that time ever came, I could be like, oh, I've used this before. Obviously, it's not going to get, you know, reduce the anxiety of these things happening. But there's a lot of anxiety because there's complications, and you're dealing with someone's like face. The most important thing. Yeah,
you can't hide.
You can't hide that. So yeah, it's dealing with that anxiety has to be worth it. Because
a lot of hygienists and therapists do it.
And they do it very well.
They do it really well. And some people have got like really successful businesses from doing it. I've done the training in Botox, and I've done fillers, and I never used it. So I left that place and I was like, this is just not for me.
Right, okay.
For the similar reasons that I think, I'm obviously not going to say who my training provider was, but like people were coming in and it was like minimal things needed to maybe their nose. Yeah, the nose wasn't like perfectly straight with a spirit level, but they'd come in, they'd be like, I want it straight. And they'd be like, yeah, I know what you mean. And then I'm like, but there's really nothing wrong with this person. Like, why don't you just say, actually, your nose looks perfectly fine. Don't need to shove a needle into it and fill it up. So it just wasn't for me. I have nothing against people that do it, but I think we're trained in facial anatomy, so muscles, nerves. We're very well placed to do it. We have a lot of knowledge in that field. But for me, I was just like, this is not what I trained to do. Like, I trained to do teeth and gums, not to do fillers and Botox. So like I just never done it.
Yeah, we are really well placed in that field because of the head and neck, and it being our niche area that we deal with, and we know all the anatomy, where the blood vessels are, the muscles, and everything like that. I think we're very well placed. And like I say, people are doing it, and they've got fantastic side hustles with it, and even
a lot of skincare stuff now. I think when we're qualified roughly the same time, it was a lot of Botox and fillers. Now it's more about preservation instead of kind of that reactionary, let's fill you up with some
100%. And I think that's the way that that's the good thing about where it's gone, is that there's no point having all that done if the foundations on top. So there's no point dealing with the foundations and then everything on top being like, you know, the skin needs to be good quality. In fact, actually, good skincare probably makes someone look more youthful than
SPF. Easy.
Exactly. So I think a lot of people are really taking the skincare element as well as doing the Botox and fillers and sort of doing it alongside each other. And I think that's a really great thing.
That would be my dream job.
What's that?
Dermatology.
Really? Do you wish you'd done dermatology?
No, actually, do you know what? I always wanted to be a paramedic, and then it was like last minute, I was like, right, I'm going to do hygiene instead.
Really?
Yeah, I think I would love the job, and I think I would love to do it through the day. But I don't know if I could stay up through the night. And then I'm like, what happens if I'm like got a call and I'm like really hungry and I'm like, I'm going to have to do something.
I'm hungry right now.
Yeah, you know what I'm like when I'm hungry. So that's why I was like, okay, it's probably like a bit more comfortable to be a hygienist, but I would love to be a paramedic. Yeah. But now, as I'm getting older, dermatologist. Dr. Pimple Popper is like my favorite. Oh, right, I love watching them blackhead videos. Yeah. Like cyst removal when they pull it out.
Oh, that takes a certain level of like, you know, being able to stand that with you.
I love it. Absolutely love it.
Do you know what? I actually, in hindsight, I think I'd have made a really great doctor.
Oh, yeah. I think you would have been a really good doctor.
I think I'd make a really, really great doctor. And what I love about being a hygienist, actually, in the whole systemic oral health thing, is that actually we can bring elements into that and be a subject matter expert, obviously, in oral health, but bringing the body into it as well, which is it's probably why I do so much research and stuff into the systemic links, because I love
understanding the body.
I love understanding the body. I love it when someone says to me, oh, I've got, like, you know, if you're at a party or whatever and someone says they've got diabetes, and I'm like, I know everything about your diabetes, and I'm teaching them.
Show me your teeth. Yeah. Do you use a grey brush? Do you use a pink brush? Which was it?
On the front bottom.
On the front bottom.
That's from the previous episode.
Oh, God.
So, yeah, it's, I think I'd have been a really good doctor, if I may say so myself. So yeah, hindsight's a great thing, isn't it? But I do love being a hygienist.
I love being a hygienist. Like I wouldn't change it. But yeah, paramedic or like an A&E, like trauma
Yeah.
doctor. I think, yeah, I would
Oh,
love
I'd
that.
have been an A&E trauma doctor, yeah.
Yeah.
Oh, 100%. The problem with paramedic, though, is they don't get paid anywhere near as much as they should do for what they do.
For what they do
100%.
is just I can't remember what they're on. Are they on band 5 or band 6 or something?
Yeah.
It's a lot of stress.
Yes.
I mean, you're dealing with like acutely ill people.
Life or death situations.
Oh yeah, or like picking people up off
Yeah.
like car accidents and stuff.
Yeah.
And yeah,
They don't get paid
it's
anyway.
not enough.
Yeah, it's just not enough. And then the night shifts and stuff.
No,
Bless
not
them.
for me.
They need more money if anyone's listening.
Yeah. If anyone who's in charge of the NHS at the minute, it's just changed, hasn't it? If anyone's listening to this podcast, paramedics
gonna
need
be?
more money. Yeah, exactly. Okay. So something that's been brought up a lot. I've had a few I've had a lot of questions over the years. Quite a lot of questions recently. You'll be able to help with this because you're great. Oh, thanks. Working with big brands, how do you do it? And people want to become this like instant influencer. I want to know your thoughts before I give you mine.
Okay, yeah, I feel like I get asked this a lot. In fact, the other day I got asked this again. How
It's
do
usually like messages on Instagram,
yeah,
isn't it?
it's
Like,
always on Instagram.
I want to be an influencer. How do I do it?
Or
I'm like,
I want to work with this brand.
Yeah.
How did you do it? And sometimes they're not even showing that they've worked with that, or they advocate that brand, or they use that brand. They just want to work with that brand.
Yeah.
Yeah, it is a question that gets asked a lot, and I think it's people just want. I think it's social media. People just want to be someone on social media. Maybe they feel that if they're not, they're lesser because of the comparison that they're putting on the people that put themselves out there. What you need to know is that is absolutely not the case, and a lot of things. I'd like to say nothing I put out there is smoke and mirrors, but what I've learned in dealing with a lot of people in social media circles is there's a lot of smoke and mirrors.
Yeah.
And what you see is
It looks glitz and glamour and like, oh wow, I'm doing this.
Yeah.
But I think it is hard work.
Yeah. So working with brands and doing that scene, it's a lot of hard work. It's not, that 30-second video that you see took days.
100
weeks,
takes.
100 takes. It took sending backwards and forwards to the company, the legal team, blah, blah. It took hours and hours and hours to make, to edit, to put together. And
contracts
only being able to say
very lengthy contracts.
Yeah. And also I think, so my advice is, so if someone's asking me for advice, the first things first is you need to be using it and advocating it.
Yeah,
because
100%.
you should never, ever try and work and say something that you don't do. It has to come from a place of passion because people can see through it. And I'd never work with someone who... I've actually had companies approach me and they were like, they'd be saying, oh, can you talk about this? And I've actually said no, because I'm like, I'll be honest, I don't hand scale very often. And if a company came to me with hand scalers, I'd be saying, I don't do that. I can't possibly talk about that. That's not my area of expertise. There are other people that do that very well. So I'd send them in their direction instead of my direction. Yeah. And the companies that I work with, it's always come about organically, where I've been already talking about it on my social media platforms, or I've already mentioned it in a lecture, or I say that I'm using it because it's true. It's come from an organic place. And then on the back of that, they've said, oh, if that is something you're using, would you mind talking about it a bit more? And then it being a bit more of like on a level of like influence, instead of it just being me advocating it as Claire Louise. So everything I've ever done has always been organic, and I'm very much sort of wanting to only work with companies that I advise for my patients and I use myself. And so I have like maybe three companies that I work with very closely with, and then that's it.
I think that's a really good point. The number. So I'm the same. Like, I think a lot of it does come down to social media and, okay, I want to be like this person. I want to be like that person. That person's got 15,000 followers. I've only got 7,000 followers. I've only got 2,000 followers. it just needs to be organic. I think if you are just genuine, if you are yourself, you do things that you truly believe in and you do feel passionate about, the rest will come.
Yeah.
I think it's when you try and force sales. Sometimes we see clinicians and they work with 7, 8, 9 different companies and that's just like too diluted. It's like,
who are you?
Who are you? Yeah. Who do you represent? Because at the minute you represent everyone.
Yeah.
Do you really use all of these brands?
You can see through it, can't you?
You can, as soon as you get on the lecture circuit, if they're ever doing a lecture on it, if they don't fully believe it,
yeah,
there's no way that it comes across as genuine. Like,
yeah.
I as you know, I've been doing loads of stuff with Listerine, which we done that board together, the hygiene board, back in, when was it, 2021?
Was it 3-4 years ago?
It's like 3 or 4 years ago.
Oh my God, yeah.
And we went in there and we were very honest. I was probably a little too honest at some points, but I was like, I absolutely don't believe in this product. I never recommend it. It's just not for me.
Yeah.
And then obviously by the end of that day, I was presented with the evidence, changing S3 guidelines. I was like, fine, okay. You've got me on the research. I'll go home. I used that Listerine kind of every day for 3-4 months myself. And then I was like, actually, I'm starting to like see results. I started to kind of pick little patients that I thought, okay, this might be beneficial. And then it was like a year later, Listerine got in touch and were like, would you be interested in working with us? And yeah, because now I do believe in the product and I believe in all the evidence behind it and what you can achieve.
Yeah.
Whereas had I maybe not trialed it myself or not really listened to the evidence and I was just desperate to be known for something and said yes, that would be really hard. Like we've done shows around the country, and to do that without genuinely believing in a product would be super intense.
Oh, yeah. I think getting up and lecturing is a stressful situation anyway. And that's another point that I say to people. If you've never done that, if you've never got up and lectured or educated, that's a skill in itself. Like the anxiety, no matter how many times you've done it, there's still an anxiety level
I
there.
still get super nervous before I'm about to go up.
Yeah.
It doesn't matter where it is, whether it's in front of 10 people or whether it's in front of 100.
And can you imagine doing that if you didn't fully understand?
That's the answer.
Advocate? You couldn't. There's just no way you could do that. And the crowd would rip you apart, or you'd rip yourself apart.
Yeah.
It'd be horrendous. And so yeah, you definitely it has to be something you truly, truly believe in, but not just because someone came up to you and asked you to say it. Like you've got to believe in it to your core. And it's a similar sort of situation. I was posting about Oral-B IO toothbrushes on my social media, and that's how I ended up working with Oral-B, is because I was saying about Oral-B IO and how I recommend that for my patients, and it'd be like the list of things I recommend for my patients, and I didn't work with them at all at the time, and that led to like writing an article. They were like, "Oh, well, do you mind talking about your experience of this?" And then it just kind of snowballed from there, really. And similarly with EMS, I went on a course. It was Faye Donald's course. She's absolutely outstanding. I was like, this is how I want to work.
Big up Faye. Woo!
Big up Faye Donald. And so that all happened organically, just through then me going, oh God, I love this for my patients, posting before and after photos, shouting about my treatments on social media. And then that all happens organically too. So I'd say be patient and just do what you believe in. Obviously, you've got to put yourself out there, because you're not going to be an influencer if you're not trying to be on social media. Yeah. But put yourself out there, but with what you believe in, and then if it's right, it'll come to you.
Agreed.
And if you're wanting to get down the education route, start like going into public speaking, even on a very, very small level, study clubs. Run a study club. See if it's what you want to do. Because a lot of people, I know some people that have got themselves into a position of lecturing, and then it was not for them because it's so scary.
It is really hard. I think it's a lot of work. You have to be subject experts in whatever you're teaching.
Yeah.
You have to prepare the lecture. And then if you're working for like big corporations, you have to get it approved to make sure everything's kind of correct. You might have spent hours and hours and they might turn around and be like, no.
Yep.
And then you have to go back.
Oh, yeah. We've all been there.
Yeah. It is an awful lot of work. Yeah. I think just being prepared for that as well. I think having tough skin, because like you said, if you don't believe in it and people ask you questions, if you're not necessarily prepared to fight for what you actually believe in and then use kind of research evidence and stuff to support your answers, you're just going to crumble.
Yeah. And it's a lot of pressure. Like you say, I've been in situations where, a 30-second video has taken me 4 days to create. And then it's by up to that point of creating it, it's gone through a whole system of going to a legal team. Everyone's making sure everything you're saying is right.
Yeah, what you can say, what you can't say. Make sure you get the key points in.
Yeah, is it evidence based what you're saying? And then you do the video. The whole video is great. It's got subtitles, everything, and there's one word that needs changing because someone just before approval has said it, and then that one word, you can't just take a word out of the video.
No, you have to do the whole thing again.
Oh God, so frustrated, but all worth it because I feel so proud to work with who I work with. To be chosen by Oral-B to educate, I do the social media and to do some of the education stuff, it's a pinch me thing still to this day, even though it's been a few years. And whenever I get the calls from them, I'm like, I can't believe they choose me because there's so many people to choose from. And I guess it's just me being me. I don't know.
It's just you being your genuine self. I love social media. I think it's definitely got its place. I think it's a really good educational tool. I think it's really good for building communities within, obviously, professionals like hygienists have come together. I worry, obviously on the wider scale for society, yes, but also I think there are a lot of pressure from obviously where I work at the Eastman that students are coming out and they're already putting a lot of pressure on themselves, but they're thinking I need to do this, and this to be something or to be the best.
Yeah.
And it's absolutely not true. And I think that's where it can get quite dangerous.
Yeah.
Again, going back to the facial aesthetics, it's just unrealistic expectations. Just because you qualified 3 months ago, 6 months ago, you're not going to be able to achieve anything that someone's qualified 10 years ago and has all that experience.
Because I can guarantee you now, and if I'm being honest, thinking back now, a very high percentage of the people that ask me those questions, they are pretty newly qualified. Within the last 5 years, I'd say.
Yeah, I think definitely 5 years under your belt. You need to kind of work through, even working in different clinics. You can't just work in a nice high-end clinic. I think you do need to see the ones where you're like, oh God.
Yeah.
And just get as much experience as possible.
Yeah, agreed.
Because you weave it in. I still weave things in from when I first qualified, when I worked in an NHS practice.
Yeah.
Years and years ago to my teaching now. It's that lived experience that I think people really invest in.
And this is kind of what the podcast has been about. We've been through it all. We've lived through working in those really difficult, I had 15-minute appointments when I first started.
No way. So I had 20-minute appointments. I couldn't do 15.
Yeah, well, I quickly got them onto 20. I've felt lucky to have that. Did I tell you the dentist said to me I should be grateful because he could do it in 7. And I had more than double the amount of time he had to do it. And I was like, what are you doing in 7 minutes?
The patient's already in the chair, though. If you're doing an exam and then a scale on lower 3-3.
Yeah, you're doing 2 teeth. Anyone can do
that.
But yeah, so because we've done all that and we've lived it and we've done the hard work and now I'm at a point where you're creating what you want it to be through experience, then that means that we can sit and do a podcast and talk about all of those lived experiences. So yeah, I think experience is definitely key. And I think companies are probably looking for that as well. They probably want that experience because then it's more credible then, isn't it?
Yeah, but it's not all about followers. It's about engagement. You might have 500 followers, but each one of those 500 might engage with a post. You might have 20,000 followers and 200 people engage with the post.
That's an interesting topic, actually, because it's not all about having those hundreds of thousands of followers and that makes you an automatic influencer. I think influencer marketing is changing and they actually want your engagement to be good. And actually, that's the metric they're looking at now, not the numbers. So, for example, if you're working with a company that wants a lot of they want to get the message out to clinicians. If you've got a social media following absolutely full of patients, that's not. Then you're not the influencer.
I would not consider myself an influencer. I done the Gums Guy. I think it was during COVID actually, and it's kind of just all been organic.
Yeah.
I haven't really pushed anything. I've just literally been myself. Yeah. Hopefully I've showed multiple sides of normal life, obviously. Pilates being the biggest one. And obviously teeth. And then that's just it. It's just kind of grown to where it is. And I'm not fixated on oh my God, I've lost 3 followers. Like, what did I do? I'm just like, it is what it is. Like,
I couldn't tell you what I've got now, what I've lost, and anything like that. But what I will say it's good for yours is you're very, you've got a lot of clinicians on yours. So
yeah, I've got a lot more clinicians than patients.
Yeah, I think you're a valuable kind of like clinician focused social media influencer.
I'm not an influencer. The Gums guy is not an influencer.
You are an influencer.
Like 3,000.
You influence me, so you influence her.
Yeah. My behavioural change expert skills kicking in there.
But yeah, so don't focus on numbers. Do you know what? Like I say, I don't know. I can't remember the last time I even thought about I don't know how many followers I've got actually.
I think like 5,000 or something.
I think probably mine.
Watch, you'll get to the car and it'll be 1,000. You'll be like, I've lost 4,000. No, I think the key message is just be yourself, be organic, and let it grow to be what it's going to be.
Yeah, just plug just keep working and chipping away on what you believe in, and if it's for you, it'll come. Don't chase it, because forcing something,
you'll make yourself ill, and you'll feel disappointed in yourself, and that's not what it's about. And also, it doesn't make you a better clinician if you work with someone or if you don't, because most of what you see is smoke and mirrors. but no one is any lesser a clinician. So social media and having a following or working with a brand does not make you better than someone else. No, not at all.
Not at all. You're fantastic as you
are. And you're a listener of Your Dental Besties podcasts. Maybe you're just a little bit more special. You are. If you listen to us and you subscribe, like and share, then you are a little bit better. Just a little bit.
Well, on that note, I think that's that sort of episode done.
Yeah.
Oh, they go so fast. I don't like it.
Oh, no.
On to the next. So if you like this episode and there is takeaway bits that you think that you can either share or take away for yourself, then please like, share, comment, send us in your questions. We can answer them.
Queries, anything you want to discuss on the podcast, send it in and we'll bring it up.
Just realised we didn't do agony aunt and agony uncle on this one.
Maybe a double next time.
Yeah, let's do a double one next time.
A double.
Great to see you. Great to see you guys again. Bye.
Bye.